So, fun story. A few weeks ago, I was in a planning meeting discussing the next episode of The Exam Room, which was set to be on the dangers of heart attacks while snow shoveling, when I turned to a coworker and said, "But wouldn't that be weird since it's barely snowed all winter?" I guess I had nothing to worry about. I tell you the story for a few reasons. One is that I feel we caused all these blizzards. Two is to tell you why January's episode has been delayed. And three is to say that removing all the snow can put quite a strain on your back, your heart, and for some of you married fellas out there, your marriage. But since marriage issues really aren't our thing here, today I am talking to Dr. Joseph Brennan, a Yale cardiologist who could tell us the warning signs of winter heart attacks. Okay, it is freezing out here. For those wondering at home, a suit jacket is not proper winter attire. So I'm gonna go inside, and join me when I'm nice and warm inside the exam room.
There are intrinsic dangers and inherent dangers actually in shoveling snow. The effort of shoveling snow is quite substantial. It involves isometric activity, weightlifting. Individuals that tend to do it also tend to be the most sedentary individuals, and they go out and do very hard labor early in the morning without warm-up, and typically also after ingestion of a large meal. It's the perfect storm. The cold has a number of complicating features as regards health. Number one, cold, the body to protect itself vasoconstricts or tightens down on the arteries. In addition, cold may precipitate clotting and thicker blood, all of which may contribute to heart attacks. So the classic pattern of crushing chest discomfort going to the left arm up to the neck may not be true. Perceived excessive exertion, sweating, because sweating is not common obviously in cold weather, or excessive shortness of breath may be symptoms. The highest risk group are those that are sedentary at baseline. So regular activity, going to the gym, working out, watching your diet, maintaining a good body weight, all of those are extraordinarily important to prevent adverse cardiac outcomes. So there's a lot of things we can do. We are occasionally forced to shovel snow. Our blizzard 2 years ago, where we had almost 4 feet of snow here, prompted a number of us, myself included, to go out and shovel snow. I did it in small patches. I also covered up because I knew the effect that shoveling, that exposure to cold could have. And any perception of significant stress, perceived effort, stop.
This is better. Now, Dr. Brennan says if you're worried about having a cardiac event while snow shoveling, the best and easiest solution is, well, just to hire someone to take care of your driveway, especially if the snow is very wet and heavy. And if you are shoveling and start getting short of breath, dizzy, or nauseous, stop what you're doing immediately and go see a doctor. Well, thanks for watching, everybody. Stay warm and make sure to join me next month in another episode of The Exam Room.